balance this out? Where's our health folks? Okay, good morning. As you know, the Centers for Disease Control and Prevention notified us yesterday that they had released an individual into our community who, after 2 consecutive negative tests, was tested weekly positive for the coronavirus. This was the one and only person who had tested positive for the virus of the 91 evacuees in the original cohort that was brought to Lackland Air Force Base from Wuhan, China. The person had been treated in isolation, was not showing any symptoms, and had 2 negative tests for more than 24 hours apart. This met the CDC's criteria for release, and the person was released Saturday. Unfortunately, after the person's release, the CDC received the results of another test that showed a weekly positive confirmation of the virus that causes COVID-19. The person was brought back in isolation and is now being monitored. As mayor of this city, I find it totally unacceptable that CDC would release a patient prior to receiving all test results and potentially expose the public to this harm. Local health professionals, in whom I have the utmost confidence, are working very hard to prevent the spread of this virus here in San Antonio, and we simply cannot have a screw-up like this from our federal partners. As a result of this, I strongly believe that all the individuals who are scheduled to be released from the 14-day quarantine today should be retested and kept in quarantine until the results confirm that they are negative for the coronavirus. We're working with our state and federal partners to achieve that result, and I will do everything within my power to make sure that that happens. While the CDC is encouraging everyone to wash their hands and prevent the spread of the virus as we would during this season, I would encourage the federal administration to not wash its hands of the responsibility to protect the public. The judge and I have been in conversation with the governor and our partners at the state level, and I believe we all share concern that today's scheduled release of the cohort from the Diamond Princess cruise ship is handled appropriately. So let me hand it off now to Bexar County Judge Nelson Wolff.
Well, first of all, Mayor, let me thank you for your leadership and for your Metro Health Department headed by Don and the tremendous work that they did all day long yesterday. It was quite a frustration Sunday, I might add, all day long, trying to get to the bottom of this and trying to get the CDC to say what happened. But while that was going on, your Metro Health Department did a lot of good work yesterday, and I think you'll be hearing about that in just a few short minutes. It's been, over a week ago that both Mayor Nirenberg and I wrote a letter stating that testing should be done, adequate testing, symptoms, verification of the test before anybody was released. In this case, the person tested positive, negative, positive, and it should have never been released into our community. We had over 235 people come here, both from China and from the Princess. That's a big responsibility that was thrust on our community, and we think it's very important that the state handled themselves in a much better manner. I was pleased to see, as the mayor stated, that the state of Texas has stepped up and said there should be a third test given to the 120 people that are left here before they are sent out into the community. But again, I just want to express my appreciation to the Metro Health Department and to let the citizens of San Antonio know that we're doing everything within our power to protect our community to make sure this disease does not spread. Thank you.
Thanks, Judge. And now I'm going to ask Don Emmerich, our Metro Health Director, to come up and give a little bit more detail in what we know about the situation from yesterday. Don.
Good morning, everyone. I'm actually going to also ask Dr. Kurian to come in. She is the one that's been leading with her team on the investigation and looking at the potential exposure of the situation that we are talking about this morning. So I'll just give you a little bit of an overview, and then I'm going to ask Dr. Kurian to come in with some of the details. Certainly the mayor and the judge have given you the information. We did have an unfortunate situation, but it's also really important to say that these protocols of the two consecutive negative tests that were performed did meet the CDC standards. Just like you've heard already, we also, from a Metro Health perspective, we also support, given the situation that has just occurred, we do support the third test before any of the evacuees that leave the base today. So we definitely support that. I will tell you that throughout the night and also this morning, not a lot of us have had a lot of sleep, but we have been in constant contact with the state and with CDC about identifying what are some of those protocols we can update. And so those discussions are occurring. So I think that we should see some movement in the approval of the expanding of the protocol to expand those two consecutive negative tests to 3. So some of those discussions are happening at the very high level, and I suspect that we'll see some movement on that. So at this time, I'm going to pass this over to Dr. Kurian, who can give you some really good detail on the work that her and her team have been doing.
Good morning, and I'm going to keep this very brief. Yesterday, we were notified that this person was, in the morning, that this person who was scheduled to be released from the hospital that the person was receiving care, because the person had met all the CDC criteria for medical release at that time, was released out in the community. Person was out in the community for approximately slightly over 12 hours. And so it was our responsibility to make sure we contact every possible venue that this person had visited, or persons that this person had come in contact with while this person was out, released from the local hospital. So we did identify all the exposure sites. We followed up with all the persons who have been exposed. We've completed our risk assessment, I can say pretty much everybody has been deemed to be low risk except for few selected healthcare personnel who were directly in contact with her at the time of her release. That's it. Thank you.
Okay, and let me just summarize again. The news yesterday about the woman who was released and then brought back into isolation has caused understandable concern in the city we serve. Our offices are flooded with comments of concern, as you would guess. In the past 24 hours, the Metro Health Department has conducted a contact investigation, as you heard, to identify where the person went after being released, with whom they were in contact, and what risks exist that those individuals were exposed. So we are pleased to share that with you, and that the investigation has revealed generally encouraging news considering the circumstances. The number of people is small and the risk of exposure is low. So at this point, we're going to turn it over now to questions that you might have for the folks here. I will emphasize one thing, and the judge said this. There is nobody better that does this work than our Metropolitan Health Department. They've been working 16, 18 hours a day for the last 3 weeks, and they've done exemplary jobs. What we are asking for is our state and federal officials to cooperate to make sure that we are in the best position possible to ensure the safety of the public at all levels. So at this time, we'll take any questions you have.
And if you're going to share that, if you're not going to share that information, why not? I feel like a lot of people would want to know places that they should probably avoid. It's in this area. 30 steps to the mic.